Hello, I'm Dr. Julian Sampson and I have a very special interest in TSC. Now, I'd like to share some of my experience of the disease with you, from my point of view. The age of the person coming to see the geneticist is going to determine, to some extent, where the issues and questions are likely to go. For example, if we see a mildly affected adult who has only recently had the diagnosis of TSC, they may not have had a comprehensive assessment of their problems. So there's a need for this patient's medical management to be brought up to date, and there's an opportunity to offer some investigation into the extended family. In this situation, it's very likely that the immediate concerns of the parents will be in relation to the child's health, particularly if it's a young child. They're very likely to have concerns about their child's brain development and what the future may bring. However, it's always possible that one of the parents also has TSC, so they may need to prepare themselves for the fact that they may have passed on TSC to that child. And if so, there may be health implications for themselves, as well as for the future pregnancies. But if the child is a sporadic case, the parents are going to be free of any TSC manifestations, so their only focus will be, what does this mean for my child now and in the long term? This is particularly true if the child is an infant, because of the great variability of severity in TSC and the difficulty in predicting outcomes at an individual level. In particular, there may be concerns about prospects of epilepsy, autism, and learning disabilities due to involvement of the central nervous system. Genetic testing can provide much insight. That's because it's much easier to provide definitive advice if a mutation has been identified in an affected family member. A genetic blood test will then give the answer as to what the genetic status of a relative is. For example, someone comes to me and says, "Look, my brother has a child with TSC. My wife's now pregnant. Is there a risk that our child will have TSC?" Well, that individual can have a blood test for the mutation identified in his niece or nephew, and that will clarify his own genetic status as either being a gene carrier or at population risk only.